Okay, so we've got 4 outcomes for this. All right, some of this will be review from your physiology class. Some of this will be new, like this last one. Okay, so cardiac output, what is it? Well, it's a measure of flow in the heart. Remember, flow is volume per time. So normally it's liters per minute. Okay, to calculate it, it's heart rate times stroke volume. All right, remember, with the heart, you can only change 2 things. You can change how often it contracts and how hard it contracts. So how often is the heart rate? How hard is the stroke volume? That's it. Okay, and then by doing that, we're ultimately going to affect cardiac output. And cardiac output is kind of the big thing. So stroke volume. When it comes to diastole, remember, stroke volume is the amount of blood that leaves the heart every time it contracts. It's affected by a few things. We've got preload, and remember, preload is the pressure that's in the heart prior to contraction. Okay, so the heart's not contracting, so the only thing that can cause pressure is the blood. Okay, so the amount of blood that's in the ventricle prior to contraction is what's causing pressure. And so this corresponds with end-diastolic volume. Okay, stroke volume can also, during diastole, can also be affected by filling time. And filling time is just that, the amount of time the heart has to fill up with blood. Okay, so the longer the heart is in diastole, the more time it has to fill up with blood. Now think about this in terms of heart rate, right? What happens to filling time as heart rate increases or decreases? Okay. So next we've got stroke volume, but this time during systole, so when the heart is contracting. So we've got ejection fraction, which is the amount of blood, or the percentage, it's not an amount, it's a percentage of blood that leaves the heart during contraction. Typically it's around 60%. It can be a little higher, it can be a little lower. But in some cases, people with heart failure or heart problems, the ejection fraction will be in the 20s, which is not great. So ejection fraction is affected by afterload. And remember, afterload is the pressure the heart has to contract against. In order for blood to leave the ventricle, the ventricular pressure needs to exceed aortic pressure. So if a person has high afterload, that means the heart's going to have to generate more pressure, which means it's going to take longer for the heart to get to build up that pressure, to open it up. And so then there's going to be reduced ejection time. Okay, and so ejection fraction is also affected by how long the heart is in systole. All right, so the longer we're in systole, the more blood that we'll be able to get out. But if I have high afterload, that can kind of counteract it. And then it's also important to know that as heart rate goes up, ejection time goes down. And so we're going to have to generate more pressure. Next, we've got torsion of the heart. Okay, so torsion just means twisting. So hence, we've got Chubby Checker doing the twist over here. So this is a concept that I really I want students to understand better. And it's one that they struggle with, and I'm not completely sure why. And so I'm going to call it what it is. And so focus on this. Okay, when heart rate goes up, filling time goes down. When heart rate goes up, ejection time goes down. All right. However, cardiac output goes up. So if we think about that, if I have increased heart rate, decreased filling time, preload and stroke volume should decrease. Okay? But that's not really what happens. And so when we have increased contraction or increased frequency of contraction, we actually fill the heart up with blood even more than normal. So how is this happening? And this is happening due to torsion of the heart. Okay, the way that the heart actually contracts is similar to what goes on when you wring out a towel. Okay, there's this twisting motion. And this twisting motion does a couple things. One, when it's contracting and relaxing, energy is stored. Okay, so relaxation causes this energy to be released. And really what happens is you get recoil from the muscle fibers, from tighten. Remember when we were talking about the winding filament theory? And so what this does is this creates a pressure gradient that pulls blood into the ventricle. So basically we're sucking blood out of the atria and into the ventricle. Okay? And that's because we're releasing energy during that relaxation phase. So exercise increases the energy storage that goes on during contraction, and then it increases energy release during relaxation. And as a result, we create kind of this vortex or this suction that gets blood, that helps get blood into the heart. Now, there are a couple other things that help as well that we'll talk about later, and things that you already are familiar with. But when I ask you on a test what causes or how we can compensate for this decreased filling time, and I ask you to explain it, don't just say torsion. Okay, explain what is going on. And so having said that, can you do these three things?